saying more than 200,000 in this country could die from coronavirus. As the death toll climbs past 4,000, more than 1,000 dead in New York City alone. As Governor Andrew Cuomo confirms, his brother Chris is now battling COVID-19. And new questions about whether all Americans should be wearing face masks. Why the CDC is considering a change in policy. The Surgeon General joins us live.
Crisis on the front lines. Healthcare workers under siege. The doctor who shared these dramatic images inside Elmhurst Hospital now confirming that she has tested positive. As more medical professionals sound the alarm, EMS workers overwhelmed by a record number of 911 calls. Now FEMA rushing hundreds of extra ambulances to New York. The head of New York's emergency medical services joins us exclusively live.
Drama on the high seas. The cruise ship stranded with hundreds sick on board and 4 already dead. Now fighting to dock in Florida, but the governor saying not so fast. How President Trump is responding.
Supermarket safety. Advice from the top infectious disease expert. How she shops, from the shopping cart to the checkout line, and what she does when she gets those groceries home.
Rent rebellion. As mortgage and rent payments come due, calls now growing for a national rent strike amid those record unemployment numbers. The Sharks join us live. What to do if you need help paying those bills.
And social distance dancing. The way neighborhoods and families from New York to Nashville are staying together while keeping apart. The moves that will make your morning.
Live in Times Square, this is Good Morning America.
Good morning, America. Happy to have you with us on this Wednesday morning. And good morning to you, Robin and George.
Good to see you there, Michael. And while people, as you know, are doing their best, trying to make the most of this very difficult moment, George, the president did strike a very somber tone in his latest briefing.
Robin, he was as grim as he's been through this entire crisis, and quite a striking difference from how he downplayed the severity in those first weeks. Here's what he said last night. Warned the nation to be prepared for a really rough 2, even 3 weeks. And the numbers are simply mind-boggling. We could reach more than 200,000 deaths, according to the experts. But Dr. Fauci did say that he hopes with mitigation efforts it won't climb that high. And we do want to show you one hopeful note this morning. It comes from Italy. Take a look at this empty waiting room, overflow waiting room at a hospital in Parma, Italy. That room is normally packed with coronavirus patients. Their curve may be starting to go the other way.
That is something that's good to see, George. But we begin here in New York City, which has quickly become the global epicenter of this disease. Whit Johnson starts us off near the Naval Hospital ship. Here, the Naval Hospital ship Comfort, which is here in Manhattan. Good morning, Whit.
Michael, good morning to you. The U.S. Navy ship Comfort behind me here has already started to see patients. It will act as an overflow hospital for the New York City area, treating people who do not have COVID-19. Meanwhile, across the country, more states are enacting tough new restriction, bracing for worse days ahead. This morning, a somber milestone. Coronavirus killing more people in the U.S. than the terror attacks of 9/11. More than 4,000 falling to COVID-19. The loss of life only expected to climb. The White House Coronavirus Task Force revealing grim models, estimating the virus could kill between 100 and 240,000 people in the U.S. alone. President Trump warning Americans of a painful 2 to 3 weeks ahead.
The experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks.
And now fresh debate among the nation's top doctors about whether CDC recommendations on face masks should be revised to include the general public.
It's just being considered by the task force now about whether that recommendation that already exists relevant to wearing masks should be altered in any way. So it's still under discussion.
But amid growing shortages, doctors want to make sure medical professionals in hospitals across America have the masks they need first. Those on the front lines are under attack.
All the patients in this room, all the feet that you see, they all have COVID.
Dr. Colleen Smith, who shared these dramatic images from Elmhurst Hospital in Queens with ABC News and the New York Times, now confirming she's tested positive herself for COVID-19, describing her symptoms as mild. Dr. Smith among a growing chorus of healthcare workers sounding the alarm. In New York, Governor Andrew Cuomo still clamoring for medical supplies, including those sought-after ventilators.
Anyone who says, oh, maybe you don't need that many ventilators. You're saying 30,000 ventilators. You don't need that many. You don't really believe you need that many. You know how you know I really, really believe that number? Because we are paying $25,000 per ventilator, and we are broke. And the last thing I want to do is buy a single ventilator that I don't need.
The governor revealing his own brother, CNN anchor Chris Cuomo, is now positive for COVID-19.
He's an essential worker, member of the press, so he's been out there. He's a really sweet, beautiful guy, and he's my best friend.
But while the number of cases continues to soar, signs of hope and recovery. 44-year-old T2 Pamachan, a father of 3 who has been on a ventilator and was put on that experimental Ebola drug, is now awake and talking.
It's just awesome to talk to him and hear a voice on the other end of the phone when we call him. It's really special.
And a hero back to work. 41-year-old Dr. Ross Grant spent 3 days in the hospital after contracting COVID-19. Tuesday was his first day back on the job as an internist at Cedars-Sinai in Los Angeles, eager to continue his mission to save lives.
I'm feeling, inspired to be back here, actually. I mean, it's nice to see the camaraderie of everybody at the hospital really working their hardest.
Nationwide, the Army Corps of Engineers is racing to build as many as 341 field hospitals. Some of those have already been constructed here in New York State, where more than 75,000 people have been infected. Robin?
Yes, Whit, thank you very much. And as you said in your report, one of them is the governor's brother, Chris Cuomo, who was a former colleague of ours here at ABC and part of the GMA family. And like everyone else, we're sending him our best, and his family as well. Joining us now from Washington is the U.S. Surgeon General, Dr. Jerome Adams. Dr. Adams, thank you again for joining us. We really appreciate your time. We know how busy that you are, but want to get your thoughts on some things, because at first it was said 15 days was needed to slow the spread. Then the president extended it to the end of April. Many people are wondering, what are the chances that that's going to be enough, Doctor?
Well, the original 15 days was designed to slow the spread and for us to have time to reassess. And we learned some good things and some bad things. The bad things that we learned are that there are places across the country, no place has been spared, no state has been spared from the spread of this disease. But the good news is when you look at places like Washington, when you look at places like California that aggressively mitigated in social distance, they were able to level and flatten their curves. And so we're looking at this next 30 days as an opportunity for the entire country to really understand if we do the right things, then we can flatten our curves in our own different areas and actually get to the other side. You ask, is 30 days going to be enough? Well, it will be for some places, it won't be for others, depending on where they are on their curve. But the most important thing to know is that if you are aggressive about mitigation, you can get through to the other side, and usually in about 3 weeks or so to hit your peak and start to see cases come down.
That is the hope. The debate about masks, I know about a month ago you weighed in at first and you were saying, do not buy, do not wear masks if you're healthy. And now the CDC and others are changing their recommendations. So where do you stand right now on people wearing masks that do not have symptoms?
Well, thank you for the opportunity to clear the air on that, Robin. Initially, the CDC, the World Health Organization, and my office recommended against the general public wearing masks based on the best available science at the time in terms of whether or not it prevented the wearer from catching coronavirus. Now, we've learned about this disease, and we've always said we're going to learn more, we're going to adjust, and we've learned that there's a fair amount of asymptomatic spread. And so we've asked the CDC to take another look at whether or not having more people wear masks will prevent transmission of the disease to other people. But here's the most important thing. Even if you do wear a mask, it can't be at the expense of social distancing. We don't want people to think, hey, I'm going to wear a face covering, so it's appropriate for me to go out around other people. The most important thing right now to do is for people to stay at home. And again, the CDC is looking at whether or not we should be recommending more people wear masks when they go out. The final point I would make to people on masks is if you are going to wear a face covering when you go out, please understand you still don't need an N95 mask. And if you take one of those N95 masks, you may be taking it out of the hands of a healthcare worker who desperately needs it to care for patients.
Yeah, that's a good point, and I'm glad that you made that. A final question. You were talking about how stay at home, but you know that's not the case all across the country. There are some states that have not issued that, like in Florida. Do you believe that more governors need to have stricter guidelines in their states about staying at home?
Well, what we want everyone to do is to look at these 30 days to stop the spread guidelines, including social distancing, staying 6 feet away from one another, including limiting large gatherings. We trust the governors and the mayors to understand their people and understand whether or not they feel like they can trust the people in their states to make the right decisions. And you see that many governors have said, look, we don't want to take any chances. We're going to ask people to shelter in place. But the most important thing is, regardless of how you do it in your state, you should encourage and enable as many people as possible to stay at home, including providing them social supports so that they can do the right things. And that's why that bill that was passed last week was so incredibly important. We don't want people to feel like they're going to lose their job or miss out on opportunities to be able to support their families because they're doing the right things.
And they're thinking about that. It's April 1st. A lot of bills are due today. Dr. Adams,
we're
thank
going to
you
get
very
through
much.
this, though, Robin. We really
back.
will. And the good news, like I said, is Washington, Italy, as you all mentioned earlier, even in New York, we're seeing acceleration slow down. I feel confident that we can get through to the other side if we all cooperate and do our part together.
Thank you, Dr. Adams. Appreciate that.
Thank you.
Michael?
All right, thank you, Robin. Now we're going to turn to the crisis for first responders, some overwhelmed by a record number of 911 calls. Our team followed along on several of those calls from a safe distance, most involving COVID-19 cases. Eva Pilgrim has much more this morning. Good morning, Eva.
Good morning, Michael. Yeah, those EMTs and paramedics are often the first people to come in contact with those with the virus, putting their own health at risk, going into homes to help the sick and their families.
This is the front line of the fight against the coronavirus. The EMS workers are the infantry, and they're overwhelmed. The number of calls to New York's 911 system skyrocketing to all-time highs.
This is the scariest thing I've ever seen.
At this point, they assume every call is a coronavirus patient. We followed their day from a safe distance.
Another ambulance just pulled out.
The call, this woman says her aunt is COVID-19 positive and has pneumonia. This is her second trip to the hospital.
Who's going to help her?
She's scared.
I'm scared for her.
The constant contact is taking its toll. More than 20% of the EMS force is now out sick, most with COVID-19 or symptoms of the virus. The ones that can are working nearly non-stop, sometimes armed with only limited protective gear. Many afraid of infecting their families at home.
We have dozens and dozens of members who are sleeping in their cars because they don't want to bring it to their families.
Mayor Bill de Blasio announcing the cavalry is coming.
250 more ambulances are coming right away to New York City from FEMA, from all over the country, to help us address our 911 calls.
Meanwhile, the EMS workers here continue to answer the call.
I know we're going to come down with this. At this point, it's not a question of if we are going to get it, but how bad we're going to get it.
And all the EMS workers we spoke to say they are going to be out here as long as they can. One, a stage 4 lung cancer from 9/11 survivor says he knows he's high risk, but he is out here because he says it's his duty. George, truly heroes.
Well, that is real service right there. Okay, Eva, thanks very much. Let's bring in the head of the emergency services for the New York Fire Department, Lillian Bonsignor. Thank you so much for joining us this morning. Eva just gave a sense of the kind of sacrifices your people are making every hour of every day. Thanks to you and all your troops for that. As head of the mission, just give us a sense from your perspective of what they're going through.
Thank you for having me this morning. It is, they're unbelievably courageous out there, and we've seen an unprecedented increase in our call volume. We normally operated at a level of about 4,000 jobs per day, and we are now up around 6,500 per day, over 6,000. So they are working very, very hard, and they are on the front lines of this mission. They believe in this mission, and I believe in them. They're doing an incredible job, but they're seeing a lot of sick people all day, every day.
This dwarfs even what you all saw during 9/11, doesn't it?
Yeah, 9/11 was a different situation, but this is certainly one of the biggest things we've ever seen. And the fact that it's a prolonged operation makes it even that much more difficult. So we know that our EMTs, our paramedics, all our first responders and healthcare workers are going to be coming in every single day for quite some time to see the same types of illnesses and increasing numbers of people who require help.
People who require help, but you're also being forced on those front lines to make life or death decisions in the field.
EMS people and all healthcare providers make life or death decisions every single day. They have committed themselves to saving the lives of the people that need us, and they're doing a tremendous job doing that.
Eva reported that about 20% of your workforce is out now. We know some reinforcements are coming from around the country. What more do you need?
Yeah, we have about 23% of our EMS force out on medical leave right now. Like I said, they're the soldiers on the front line, and unfortunately, they are not immune to this virus, so they are also becoming sick. We've had a tremendous response from around the nation to try to come in and give us a hand. We activated our mutual aid agreements, which brought, just yesterday, we had 120 additional ambulances from across the nation that were in the field helping. We had our volunteers that are activated. They're out there helping. All of our hospital-based voluntary partners from EMS have increased their number of coverage. So this is an all-hands war, and these soldiers are out there fighting this war every single day, and they're doing a tremendous job out there. And we're going to continue to bring as many resources in as we possibly can to ensure that we provide all the care and respond to all of those calls that desperately need our help.
We are grateful to all of them. We are grateful to you. Thank you, Chief, for joining us this morning.
Thank you very much.
All right, George, I'm very grateful indeed. Also this morning, people are finding a way to come together. You guys are going to like this. They're doing it while keeping that social distance. Take a look at this neighborhood dance party in Buffalo, New York. Everyone is showing off their moves to the Rolling Stones. The person who shot the video saying you can't help but be uplifted while being surrounded by people of all ages, inspired to dance. That is great to see. And coming up, everybody, we have the high-stakes race to get people off 2 cruise ships stuck at sea with hundreds sick on board. And now the fight to dock in Florida, the urgent plea this morning. But first, let's go to Ginger at home. Hey, Ginger.
Hey, Michael, at least 9 reported tornadoes in the south. This video is from damage from southeastern Alabama. And then we have video from Florida as well. So there were several spots hit just yesterday. There is a new storm that's developing in the northwest. The northern plains will get some snow out of it. But by Friday, there's some severe storms coming back into the forecast, especially for Texas, heavy rain in Arkansas. All right, let's get to the sunny cities now. Brought to you by Sprint.
Our priority is keeping our customers, employees, and communities safe. During these uncertain times, we want you to get the great service you expect without leaving the safety of your home. Sprint.com makes shopping easier by offering free next-day shipping and no activation fees on our best new phone deals, like the amazing iPhone 11 for just $15 a month when you switch. For now, Sprint.com is the best way to learn about our plans, buy new phones, and get the services you need. Stay healthy and go to Sprint.com today.
Getting outside today, grab a coat this morning. Jackets later this afternoon, unseasonably cool and mostly cloudy. High temperatures this afternoon get into the mid-50s, so a little cooler than average, but keep sending in some great photos. This from Keith Abernathy in Columbia, Maryland, a little sidewalk chalk. Admire nature, and definitely a great day to do that. But brighter, more sunshine tomorrow. Breezy as well, 59, 61, both Friday and Saturday. Friday's still going to be a little bit breezy.
Advice on what to do at the store and once you get those groceries home. We'll be right back.
Straight from the world's best plant scientists comes Miracle-Gro Performance Organics. It's Miracle-Gro's biggest thing. Organic plant food and soil that finally work. And work.